fellow beings, my name is Amanda and today I wanted to talk a little bit about ME, also known as Myalgic Encephalomyelitis. And the reason I wanted to talk about this was basically because there are a lot of myths that surround this illness, and also wanting to help those that also have it so that they don't feel so much alone. So Myalgic Encephalomyelitis, also known as ME, which I personally think is much easier to say, is an illness that is highly misunderstood and often critiqued because of the fact that so little is actually known about this disease. It is a devastating disease that goes across multiple systems in the body. And so because of the fact that it is a misunderstood illness and because of the fact that it is a multi-system illness, I wanted to talk about exactly what ME is and what is being done about ME. First of all, this is a disease that causes dysfunction of the energy metabolism, immune, endocrine, and neurological systems. So that is a lot of systems that is being affected by this illness. It is believed through research that ME usually follows an infection. 75% of people with ME are unable to work, and 25% of people with ME are homebound or bedridden. So that is some devastating numbers. It is a horrible disease that affects an estimated 15 to 30 million people worldwide. So with an illness like this, the question arises, if there are so many people affected by this, why isn't it more known? There are a few reasons for this, and we're going to go over them. So let's talk about the symptoms of ME, since so many people tend to have it. Because it is such a broad spectrum disease, each person is going to show it differently than the person next to them. This is also the reason why so many people go undiagnosed. So what I'm about to say may sound controversial, but according to meaction.net, which is a research site and also an action site for ME, they say that all people with ME experience a substantial loss of physical or cognitive functioning, but there is a spectrum of severity. The typical ME patient scores more poorly on quality of life surveys than those with multiple sclerosis, stroke, diabetes, renal failure, lung disease, heart failure, and various cancers. So when we're talking about quality of life, we're talking about the ability to live your life as normal as possible. So you're able to go to work, you're able to go to school, you're able to go to the store or do chores around your house. Quality of life. And with ME patients, their quality of life scores were much lower than those of the other illnesses that I just mentioned. They go on to say that onset can be either sudden or gradual, and the intensity or frequency of specific symptoms can wax and wane. So a lot of times people with this illness can have good days and they can have really bad days. And when I say good days, to most people those good days would be days that you would call in sick for work. But because our good days would be considered bad days for others, that's our new normal. So that's what we go with. Some people go into remission and can have years of normal life, and then the illness will come back. So when we're talking about waxing and waning, that's what we're talking about. They go on to say that while symptoms can fluctuate significantly from day to day, shifts in overall wellness should be measured in years, not in weeks or months. At the mild end of the spectrum, patients will lose up to 50% of their previous function. That's on the mild end. You are losing 50% of your previous function. Some are able to continue studying or working with accommodation, and by resting while not working. More moderate patients are forced to abandon the careers that they loved. That would be me. So I had to quit my job that I absolutely loved because there were no accommodations available to help me because of how severe my illness had become. At the most severe end of the spectrum, patients may live the rest of their lives in darkened rooms, unable to tolerate light, sound, or human touch. And only 4 to 8% of patients fully recover. Now that may sound pretty grim, especially when it says only 4 to 8% of people recover, but there's always hope. Now, you may be wondering, if you do not have ME, what is it like to have ME? What are they going through? So imagine that you have the worst flu of your entire life. You're dizzy, your head is pounding, Your body aches all over. Maybe you can't even think straight. You're nauseous. You can't seem to get warm. Now imagine living your entire life like this. That is what most ME patients deal with, and that is their normal. For me, I have headaches daily. Every part of my body hurts. I cannot get warm. I have a heater in my heated house because I can't get warm, and I pile blankets on myself. Then on days that are really hot, I can't cool off. So I can't regulate my body temperature. But that is my normal. The number one symptom of ME is post-exertional malaise, or PEM. This means that the ability to function as a normal human being is worsened after minimal physical or cognitive exertion. So even reading for an extended period of time, or maybe talking leisurely to a friend for a certain amount of time, all of those things can cause PEM. So when someone cancels on you and says, "I'm sorry, I can't make it," it's not because they don't like you. It's not because they're being rude. They physically cannot handle talking to someone at that moment, or they physically cannot sit up for that amount of time. So remember to be kind. They didn't choose this. They are trying their best. And trust me, they feel really bad about the fact that they had to cancel on you. So remember to be kind. I always say that, be kind. So other symptoms include sleep disturbances, pain in the joints and muscles, sensitivity to light, sound, taste, odor, touch, nausea, muscle weakness, temperature regulation, orthostatic intolerance. So that means when they stand up, they get dizzy. Even just sitting up, they can get dizzy. Cognitive symptoms like poor memory, disorientation, trouble finding words, and confusion. I know for myself, the cognitive functioning has gone down drastically, and it really is frustrating when you're having a conversation with someone, especially if it's something that you know a lot about and you cannot find the words for it. A lot of times I send myself text messages to remind myself to do things. So symptoms can be wide and varied, and that's also why diagnosis is so hard for so many people. So let's talk about diagnosis. This can be tricky. There is no single lab test that can diagnose ME. Most of the time, to find a diagnosis, it's reached by excluding other conditions that are similar to ME. In research settings, patients have biological abnormalities that are consistent between each patient, and specialists will use these tests to help them make a diagnosis of ME. Unfortunately, because of the lack of education and quite frankly, the lack of knowledge that ME even exists, most patients go undiagnosed or misdiagnosed. So let's go forward in time. You have been diagnosed with ME. What treatment options do you have? Unfortunately, this seems to be a recurring theme. There is no approved treatment for ME. This is due to the lack of information, but also because every ME patient is different. So treatments are going to be highly personalized to that patient, and treatments are going to change over time. For me, the treatment that I began with is very different than the treatment I have now because I have changed over time. So there is no FDA approved treatment for ME, and the annual federal research budget for ME is only $13 million per year. Now that sounds like a lot of money, but trust me, in the world of research, that is not a lot of money, especially when you consider that MS research gets $115 million per year. Now, I'm not saying that MS research needs to stop or that money needs to be taken away from them, because it's good research and they deserve to have the research done for them. But what I'm saying is that when you have only 11% of that budget going towards ME research, and when you also consider that ME is twice as more common than MS, it doesn't seem exactly fair. But that's also because there is a lack of understanding of what ME is, and most people have no idea that this illness even exists. Now, there are studies in Germany, Japan, Norway, the UK, the US, and Australia that have published findings on finding biomarkers for biological abnormalities in patients with ME. These studies have also shown metabolic dysfunction affecting cellular metabolism in people with ME, as well as neurological inflammation, systemic inflammation, immunodeficiency, and an altered microbiome, unquote. So what this is showing is that there is an actual physical response that is happening to people with ME. So this is telling people that this is not a mental condition, this is a physical condition. And that's one of the biggest things, especially in the US, because it is still considered a mental disorder. But studies have found that it is an actual physical disorder that is causing all of these symptoms in people. It all seems so disheartening to hear all of this, but there is still hope. There are people that are fighting to get research done, and there are doctors that are well informed, and they are willing to fight for their patients, and they are willing to help. So there is hope. There is always hope. If you have been diagnosed with ME, do not get discouraged. Right now you may seem overwhelmed. There's a lot of information, but there doesn't seem to be any answers, and you may be feeling really alone right now. But I want to assure you that you are not alone. I also want to promise you that that little lie that keeps being spread about this being all in your head, I promise you, it is not in your head. This is a real condition, and you are really sick. If you are someone that is caring for someone with ME, remember to be kind. They did not choose this illness. It is not in their head, and I promise you they are not faking it. Love them for who they are. Remember the person that they were before their illness, and remember that they are still in the body that they are in right now. So love them and be kind to them. So I hope that this helps shed some light on ME and hopefully crush some of the myths about it as well. Remember that kindness is free, so give it to everyone that you see. And I will talk to you all later. Alright, this is take 2 of this wonderful thing that I'm doing. Alright. Greetings, my fellow beings. My name is Amanda. Yeah, there's that. So there, okay. All right, I'm gonna have to talk really loud because the camera is very far away from me now. So we'll see how this goes. So today I wanted to talk a little bit about myalgic encephalomyelitis. I need to restart that because I said that wrong. So